97.5, 1280 The Zone and the Zone Sports Network. Dr. Jonathan Harrison, who's joined the program before from IVC, kind enough to join us. Doctor, how are you?
Hey, Scotty, how you doing?
Good to chat with you again. And look, there's some, we've talked about varicose veins in the past and some of the troubles they cause. This is a bit of a different topic here, and I'm going to let you handle this. But varicocele, if you have not heard about it, it's probably something, if you're a guy, you probably need to be aware of. And there sounds like there's some listeners out there that may be struggling with this.
Right. Okay. So this condition is called varicocele, and if you have it, you probably know the term. But what a varicocele are dilated varicose veins down in your nether regions, in the scrotum and around the testicles. So this is something that affects a lot of young men, ages up from 15 through your 20s and sometimes into your 30s. And so it's something that's just not really talked about. So I wanted to come and talk to you guys about it and get that awareness out.
So this is not an old man issue. This is a younger guy problem.
Exactly. So now, if you've ever, the clue to the symptoms that you feel if you have something like this is, have you ever been kicked in the nuts and have that dull ache that accompanies it? That's a very similar feeling. However, how would you like to have that feeling throughout your day? I mean, it does not go away, and it's a result of these varicose veins down in your scrotum.
Well, that's no bueno, that's for sure. So let's talk about treatments. How do guys get this taken care of?
So it's really easy to take care of. Now, the reason why, in addition to the pain that men have with this, the other reason why they want to take care of it is because those varicose veins in the scrotum, they can increase the temperature in the area, and then it leads to decreased sperm counts as well. So it's a fertility issue as well. So you want to take care of it. To treat it, what you do is you go into those veins with a little tiny catheter, a small incision in the skin, go into the veins in either your neck or into your groin, you wind your way into those veins, and then you drop a few little titanium coils in the veins, and then then you knock out the veins that are causing the problem. The root of the problem is varicose veins that are in the abdomen that kind of stretch and down into that area. And so it's important to understand, if you're feeling these symptoms, then it's really easy to fix it with a short day procedure where you're just in and out in one day.
So if somebody is struggling with this, what's the how do they contact you and IVC, and how do they get the ball moving on that?
Right. So go to our website, ivein.com, the letter I, then vein.com. You come in, we do an ultrasound to see if we can identify if you have some of these varicose veins, and then we get you on the schedule within a week or so, and you're in and out, and most people do really, really well. Those symptoms resolve within a couple days, and they're back to full activity within a week, which is awesome.
Well, that's awesome. Thanks for your time, Dr. Harrison. We appreciate it.
Thank you, Scotty.
Dr. Jonathan Harrison from IVC right here on 97.5, 1280 The Zone and the Zone Sports Network.